Mrs. G. Mrs. G. I just need to feel your tummy just to make sure your uterus is firm. Katrina, can you please come here a moment? I've just noticed a big change in Mrs. G's condition. She's becoming hypertensive and tachycardic. Her respiratory rate is up as well, and she's got significant PV blood loss. I've just started frontal massage, but it feels so high, not firm.
Okay, I'll stay here and examine her. Can you call the obstetrics registrar and inform them of the change in the woman's status?
Hello, doctor. Hi. The woman in bed 3 is unstable, and what do you want me to do? She feels okay. She says she feels okay, and she is a bit drowsy, and there has been some bleeding, and the blood pressure is a bit.
Just get back in there with the patient. Hi, James. It's Katrina. I'm the midwife in charge in the birthing suite. Sorry about that. I'm calling about Mrs. G, the 27-year-old woman who gave birth at 1600 hours after a 14-hour labour. I'm concerned her condition is deteriorating. Yep, sure. No, that's great. Thanks, I understand. Okay, thanks for your time. Priya, you can't talk to doctors like that. You sound like you haven't got a clue what you're talking about. Did you pay attention to the way that I said it? You need to prioritise. Haven't you ever heard of ISPA? Look, there's some information in here, read over it, but from now on, if there is a change in your patient's condition, come and see me and I will call the doctor for you, okay?
Priya is embarrassed. She returns to the bedside but is nervous and unsure of herself. She constantly asks Katrina to confirm that she's doing the right thing. The doctor comes to assess the patient, and she is treated for a moderate postpartum hemorrhage, and when stable, transferred to the postnatal ward with a comprehensive handover.
Hey Priya, are you okay? That was very sudden, wasn't it? I hope she's all right. Hey, I heard you were having difficulty in expressing what you needed to say to the registrar. I know how difficult it can be when we're under pressure, I completely understand. But it's really important to be clear and concise when you're trying to communicate information about a deteriorating patient. Perhaps I can help you.
Really?
I'm trained as a coach, and I'd love to give you some coaching if you'd like. It might make situations like this easier for you in the future. We could meet tomorrow in the courtyard before our shift and we can have a chat and maybe agree on a coaching plan. Would you like that?
That would be great, Lewis. I really appreciate that you are helping me. I will see you tomorrow.
Well, to begin with, Priya, well done on detecting a change in that woman's condition yesterday. It's really important. It's good that you're aware of the risk of postpartum hemorrhage and that you picked up on all the signals.
Yeah, but I couldn't tell it to the doctor.
Yeah, I could see that you knew exactly what was wrong, but you were just unable to express it in a clear and concise way. There's a skill to it, but don't worry. I'm confident with the coaching we'll get you there.
I hope so, but I'm feeling a bit embarrassed. Will everyone know that I'm having coaching?
No, not at all. Anything we discuss in our sessions is confidential and it won't be shared with the rest of the team unless I feel that there is a risk to the patient's safety. I want you to feel supported and secure. I do think it's important that we get the support of the mum though. I'll tell her about our plans and how you're progressing, and that way she can provide support as well. How do you feel about that, Priya?
Yeah, that's fine with me. I'm happy with it.
Okay, Priya, let's start with what you would like to learn first. What is your goal? How would you like to focus on the coaching?
Well, my goal is I want to be able to prioritize information when communicating a change in patient's condition.
I think that's an achievable goal for you. I suggest we start with the coaching straight away and come up with some strategies that we can work on over the next 2 weeks. Hopefully by the end of that we can measure a change.
That would be great.
So what would this change mean for you, Priya?
It would really increase my confidence level and also make my work more enjoyable. And I would be able to give better care to my patients as well. I'm finding a bit of a struggle at the moment, but it would be good all around.
Now, I know you've just recently moved to Australia. In your previous workplace, how did you communicate a change in a woman's condition?
In my old job, I was only a very junior midwife, and we would hardly speak directly to the doctors. So usually we would inform the midwife in charge if there was a problem, and then he or she could relay it to the medical team.
What about since starting here? How have you felt giving handover to doctors?
Well, since starting here, I have had some bad experiences. Some of the junior doctors I've met and spoken to here seem very abrupt and impatient in their manner. Maybe it's just me, but I often feel intimidated.
I can see how hard it can be when you start somewhere new where the routines and expectations are different. And I can only imagine the culture shock must be hard to adjust to.
Oh yes, actually there is a lot more to get used to, and every day is quite a challenge.
Maybe we can have a chat to the mum about organising some additional supernumerary days and organising some professional coaching programs. It might just help you in the initial adjustment period.
Okay, I didn't know that I could do that. That sounds good.
Okay, Priya, let's action some of these strategies. Can you think of any steps that you can take that can help you achieve your goal? We can write down an action plan so it can make it more concise for you. Have you got any ideas?
I'm not really sure.
That's fine. Think of how you would like to learn. Can you think of any useful techniques that you had in the past for learning?
Well, I like one-on-one teaching and demonstration, and I could maybe ask the educator to go through some practice scenarios with me. Maybe somewhere away from the bedside so I don't feel much pressure, and then she can give me feedback on the spot as well.
That sounds like a really good plan.
And also I like to have some reading material that I can look over in my own time, and perhaps I could ask her to provide me with some information about ISBAR. What does it even mean?
ISBAR stands for Introduction, Situation, Background, Assessment and Recommendation. I can go through that with you in more detail later. It's a great tool for communicating a change in a patient's condition, and there are also online learning packages in the use of ISBAR in clinical handover.
Perhaps you could show me how to access that. I haven't used online learning packages on the computers here yet.
Of course. I'll run through it with you when we go inside. Another thing that might be useful is the DETECT workshop that might be worth looking into. DETECT stands for Detecting Deterioration, Evaluation, Treatment, Escalation and Communicating in Teams. It's another useful tool for detecting and responding to changes in a patient's status. The hospital runs these workshops regularly.
Oh, that sounds good. I will ask Mom if I can go along to one.
It should suit your style of learning really well. You'll have plenty of opportunities to watch ISBAR in actions before using it yourself.
How will I know if I'm on the right track?
I'll let you know how you're going by giving you plenty of feedback over the next 2 weeks. I'll try and be available to supervise you during bedside handovers as long as it's appropriate and safe at the time. And you can also come and find me when you need a handover to doctors. I can supervise and support you during that as well. I'll use these opportunities to evaluate your progress and provide feedback.
Will I need to do a test at the end?
No, but I think we should sit down together at the end and do a more formal evaluation of your progress. I'll ask you to explain ISBAR and assess your ability to use it effectively during some practical clinical scenarios. You'll have had lots of practice by then. What do you think? Are you comfortable doing this, Priya?
Yeah, I already feel a lot more confident.
That's great. I think this chat's been really productive. We've come up with some good strategies. It's great to see that we're both on the same page. We should probably head into work now, but like I said, I'm available whenever you spot an opportunity for teaching or you need my support.
Thanks, Louis. I really appreciate it.
It's my pleasure.
Louise provides ongoing support to Priya over the next 2 weeks and holds a private feedback session at the completion of the coaching period. During the session, Louise praises Priya for her participation and enthusiasm and recognises an improvement in her communication during handovers. It is agreed that Priya requires further coaching to develop her confidence and competence regarding communication. An extended period of coaching is discussed to be implemented in combination with other supportive strategies developed by the mum and clinical nurse educator.